Good afternoon. It gives me great pleasure to introduce the speaker of this session, Dr. Yatan Singh Balhara, who's my colleague at NDDTC, working there as additional professor of psychiatry. And he has held various positions besides the current position in NDDTC AIMS. He has earlier worked at Dr. RML Hospital, the Lady Harding Medical College. Currently at NDDTC, he's running the Behavioral Addictions Clinic as well as the Dual Diagnosis Clinic, and these are his two major areas of interest. He's the faculty in charge of the Behavioral Addictions Clinic at AIMS. He has a very large number of publications, very widely published, and he has achieved several awards, including the Tilak Venkoba Rao Young Psychiatrist Award of IPS, the Bhagwat Award of IPS, Tilak Venkoba Rao Award by ICMR, and Dr. GC Borel Award too. So we look forward to this session.
I welcome you all to this presentation. I thank all the participants for sparing their time to attend this session. I also thank the organizers for this opportunity to interact with you. So in this particular session, I'll be talking about the diagnostic formulation of behavioral addictions in ICD-11. Presentation is going to have two main sections. I'll talk about the criteria for behavioral addictions as it has been specified in ICD-11. And in the second section of my presentation, I'll talk about what are the clinical implications of these diagnostic criteria. But before I begin with what ICD-11 offers in context of behavioral addictions, two points. We can call these points or maybe myths to a certain extent. And these 2 points that I want to talk briefly about are that it's a very common understanding these days that behavioral addictions are a new or at least a recent concept. And the second point I would like to touch upon is that it's a very common understanding that these are new to diagnostic systems. And when I talk about diagnostic systems, I am restricting myself to ICD. But even in context of DSM, it's a very common understanding that behavioral addictions are a recent addition to these diagnostic systems. These statements are not entirely incorrect, but the fact is slightly more than what it appears when you read these lines. That belief that behavioral addictions are a relatively new concept. If you look at literature, these disorders are not new. Different behaviors which have been conceptualized as potentially being addictive in nature, they date back to 1950s. That was the time when some researchers, they talked about addiction to viewing TV. Then later on, other behaviors, for example, exercise, wealth acquisition, even solving Rubik's Cube, they were considered and kind of postulated as being potentially addictive in nature. And the researchers, they came up with different criteria, how to diagnose them, the reasons why they believe these are addictive behaviors, and even approaches how to manage these disorders. And as years have passed down, more and more disorders have been added to this category. For example, sexual addiction, food addiction, and then we know the terms internet addiction, gaming disorder, and terms like that. So the point I'm trying to convey is that conceptually, behavioral addictions are not entirely a very new or a recent phenomena. Something similar, although not exactly the same, has been proposed in the past, and for many years people have been kind of postulating that there are certain behaviors that human beings can engage in patterns that can turn out to be problematic or that can lead to adverse consequences. But yes, the word behavioral addiction relatively is new in that context. Second point, that behavioral addictions are new to the diagnostic systems. Again, I would refer to ICD-9. This is the ninth revision of ICD that came out in 1975, although I guess it took a few years before it was implemented. So it was that time period between 1975 and 79 when actually ICD-9 was actually rolled out. Categories given there in ICD-9, there's this section with the numerical code 312 that deals with the disturbance of conduct not elsewhere classified. And if you go down to 312.31, it lists something called as pathological gambling there. Zoomed into this particular section. So this disorder called pathological gambling, it was part of the overall category of disorders of impulse control not elsewhere classified. As of today, we know pathological gambling has been identified as a behavioral addiction, but it's not a new addition to ICD, so to say. And way back in 1970s, it was already there. And in fact, if you look at certain websites that offer the coding for ICD-9, they also list the synonyms that can be used in lieu of that particular diagnosis. And there again, you will find that compulsive gambling, gambling disorder, and pathological gambling disorder have been suggested as potential synonyms for pathological gambling. So way back in 1970s, ICD did include pathological gambling, although the criteria that was defined to kind of identify pathological gambling was not very similar to the one that we are using in the modern versions of ICD, be it ICD-10 or even ICD-11. Does that mean that these statements are incorrect? Not entirely. As I mentioned, although specific disorders have been conceptualized for many years now, but behavioral addictions as a category is a relatively newer phenomena. Similarly, behavioral addictions are not very new to the diagnostic systems as well, but these conditions were not seen as addictions in the previous versions of ICD. 11 becomes important in that context because ICD-11 brings in something very new. It kind of makes even I'll use the phrase a paradigm shift, so to say. If you look at the section on mental, behavioral, and neurodevelopmental disorders in ICD-11, and this is a snapshot of all the chapters that are there, you will identify a category which was not there earlier. And this category reads as disorders due to substance use or addictive behaviors. So in that sense, it's a major transition that for the first time ICD has kind of acknowledged and listed addictive behaviors in the same section as they would list as substance use disorders. Expand this particular section, this section on disorders due to substance use or addictive behaviors, it has got two major categories. The first one is disorders due to substance use, and then the second one is disorders due to addictive behaviors. Now again, things are not as straightforward as they appear. Now looking at this slide, one would tend to believe that there are addictive disorders. Some of these are because of substance use, and then the others are because of addictive behaviors. And they should be similar to each other, these two categories. But that's not the case, and I'll come to that in the later part of my presentation. But before that, elaborate on what is included in addictive behaviors in ICD-11. And that again is very important. It has important clinical implications for us. So if you expand this particular category there are two conditions that are listed as disorders due to addictive behaviors. The first one being gambling disorder, and the second one is the gaming disorder. There are two other categories, but these are non-specific categories. They don't particularly mean that we can list other behavioral addictions in these categories, but these are variations of the earlier two categories which don't find a place because they are not able to fulfill all the criteria in terms of the number of clinical features or the duration, or may even be disability and dysfunction associated with them. So as far as ICD-11 goes, there are two disorders due to addictive behaviors that are listed there. The first one being gambling disorder, and the second one being gaming disorder. Through the diagnostic criteria for both these categories, they are quite similar to each other. Disorder diagnostic criteria. The description reads as that this is characterized by a pattern of either persistent or recurrent gaming behavior. So it can be something that one engages in on a persistent basis, or it may be an intermittent phenomena as well. And by the gaming, what they refer is digital gaming or video gaming, which may either be online or offline. So the gaming disorder in offline gaming behavior, which is slightly different from the way DSM-5 conceptualizes it, because there the diagnostic category is internet gaming disorder. So this is one major difference between ICD-11 and DSM-5 in terms of the criteria that have been, or the category that has been listed there. Gaming disorder in a particular person, there is a set of three clinical features. The first one being impaired control over gaming, and this control can be in different domains or dimensions. For example, in terms of onset of gaming, the frequency with which one engages in gaming, the intensity, the duration of gaming, termination, and even the context in which one is playing these games. So that's the first criteria. The second criteria is that the person gives increasing priority to the gaming, and to the extent that gaming takes precedence over other interests in the life or even daily activities and responsibilities. So that's the second criteria. And the third one is that one continues with the gaming behavior or even escalates it despite the negative consequences that one has experienced. So these are the three criteria that are listed there. And unlike many other categories, as you would recall in ICD-10, particularly the categories on substance use disorders, the number of criteria is lesser. There are only three criteria that are listed there, and as per the current description, all criteria to be present. So there is nothing like there is a list of a few criteria that is listed there, and then you need to meet a minimum number in order to qualify for a diagnosis. No, there are only three criteria that are listed there, and one has to meet all three criteria to be diagnosed as gaming disorder. Additional descriptions written there, that again is that the gaming behavior can be either continuous or it could be episodic and recurrent. So both kind of patterns are acceptable in terms of having a diagnosis or not. Then there is a criteria that this gaming behavior should result in either marked distress to the individual, or it should cause significant impairment. And this impairment can be in their personal life, in the family, in their social lives, in their academic performance, occupation, or other important areas of functioning. And finally, the behavior should persist for at least 12 months in order for a diagnosis to be made. Although there can be an exception, particularly when all the criteria are being met and they are quite severe in intensity, then you can relax this 12-month threshold that is required to make a diagnosis. Well, there, ICD-11 mentions that gaming behavior should not only be manifested during an episode of mania, because we know that in mania there can be an increase in certain goal-directed activities, and if the gaming behavior is being manifested only during an episode of mania, then the diagnosis should not be gaming disorder as per ICD-11. So I'll quickly take you through the criteria once again. So it refers to both online and offline gaming. The gaming means video gaming. There has to be three criteria, and all three has to be present for a minimum duration of around 12 months. It should cause significant distress or dysfunction in one or more area of functioning. So that's how we diagnose gaming disorder as per ICD-11. Also, the gaming behavior should not be manifested during an episode of mania. That's the criteria for exclusion as per ICD. Gambling disorder, the criteria is, I would say, is very similar as gaming disorder. Again, the gambling behavior can be persistent or recurrent, and it can be either online or offline. So both kind of gambling activities are included in gambling disorder as per ICD-11. Diagnostic features or the clinical features, the same three features are there: impaired control, increased priority being given to gambling, and continued or escalated gambling despite of negative consequences. And again, all three must be present in order for one to make a diagnosis. Significant distress or impairment in one of the areas of functioning, the behavior can either be continuous or it can be episodic in nature, and again it should be there for at least 12 months. What happen exclusively during an episode of mania, which becomes a criteria for exclusion. So the criteria for gaming disorder and gambling disorder are quite similar in ICD-11. I would say that they are quite stringent in the sense one is what behavioral addictions are acknowledged as valid diagnosable disorders as per ICD-11. And if you even hear your colleagues, you would have heard so many terms: internet addiction, mobile addiction, social media addiction, shopping addiction, sex addiction, food addiction. But if you go by ICD-11, ICD-11 acknowledges only two valid diagnoses as of now, and these two are gambling disorder and gaming disorder. So what that means is that when it comes to assigning a formal diagnosis that has been kind of listed in a globally approved diagnostic system like ICD, we can diagnose only two of these disorders. But yes, that doesn't mean that there is no research or there is no conceptualization of other behaviors as potentially being behavioral addictions. Yes, you will find a lot of research on other behavioral addictions. You will find there are researchers and academic people who are kind of writing in favor of including more disorders as behavioral addictions. But as of today, if you were to ask me, ICD-11 permits only two of these disorders to be listed as behavioral addictions, and that's gambling disorder and gaming disorder. So that's the first important clinical implication that we need to keep in mind. One is in terms of the diagnostic features. Addiction. So the term addiction typically includes certain clinical features that we are used to, and these include features such as craving, features such as tolerance, withdrawal, salience. If you would think of maybe addiction to any psychoactive substance, for example alcohol or opioids, you will always think of craving as being one of the important features there. Many individuals who have physical dependence, they also tend to have addiction, so tolerance and withdrawal is usually there. But if you go by the ICD-11 criteria for behavioral addictions, it does not acknowledge these usual or historical features of addictions as features of behavioral addictions. So please keep that in mind, that when you are taking the clinical history or kind of describing the behavior, you might identify certain characteristic features that you would like to include in your formulation. But when it comes to diagnosing or putting a diagnostic label to these individuals, please ensure that the three criteria that are listed in ICD-11, they must be there. That doesn't mean that we need not explore the other domains and dimensions. It is important to do that, because while it might not be important or essential from diagnostic perspective, it will have implications when it comes to clinical management. So please be thorough when you are making that formulation and assessment. But do remember When it comes to diagnosing behavioral addictions, you need to ensure that these three clinical features are there. Otherwise, you should not put the label there. Question is how similar are behavioral addictions with other addictions? I mentioned earlier, ICD-11 puts them in the same category as addictions to other substances. They are not similar, they are rather very dissimilar. For example, in terms of gaming disorder, if you look at the specifiers there, it calls for two major specifiers. That is, the gaming disorder can either predominantly be online or offline, and that's it. But if you look at other substances there, which are there in this category of substance use disorders, if, for example, if you look at disorders due to use of alcohol, there are different diagnoses that can be assigned. For example, episodic harmful use of alcohol, harmful pattern of use, alcohol dependence, intoxication, withdrawal. So while one may tend they might be very similar to other diagnostic categories, but please keep in mind they are not same, they are not even similar, they are quite distinct. In terms of behavioral addictions, you have the only option of making a diagnosis of gaming disorder and gambling disorder, and you can specify the predominant online or offline nature of this activity. There is nothing like harmful pattern of use or intoxication or withdrawal. So those criteria, they don't apply for behavioral addictions, and that distinction we must keep in mind. That uh, in India and many parts of the world, DSM is also very frequently used in clinical work. Although WHO is more widely accepted and used diagnostic system, but even in our teaching and in our discussions, we use DSM-5. And DSM are quite different from each other when it comes to behavioral addictions. Here I have listed the criteria for gambling disorder as per DSM and ICD, and you can see they are very different from each other, both in terms of the numbers as well as the kind of clinical features that are listed there. In fact, if you compare the two diagnostic criteria, there is very little overlap. Only two of the three criteria listed in ICD, they feature in DSM, and again DSM lists 9 criteria. ICD-11 has only 3 criteria listed there. Also, the diagnostic thresholds are very different. ICD requires all 3 to be there. DSM requires at least 4 or more to be there for someone to be diagnosed with gambling disorder. So please keep in mind they are not similar. A person who can be diagnosed as gambling disorder as per DSM might not get diagnosed for gambling disorder as per ICD-11, and the difference can be quite significant. We have done a few research studies in our department, and we have found that almost 50% of those who are diagnosed by DSM-5 criteria might not get diagnosed with ICD-11 criteria. So that's another important point that we need to keep it. Finally, the point of use of screening tools. Screening tools for behavioral addictions have existed for many years now. There are lots of tools that exist. If you look at any review article, you will find there are many tools that have been developed to kind of screen behavioral addictions, both gaming disorder as well as gambling disorder. But please remember, most of them, they are based on DSM, and they might not be valid when it comes to the ICD-11 criteria. As per my reading, as of now, there are only 2 tools that exist that have been developed based on ICD-11. One of these have been developed by our group here at AIMS. It's called Gaming Disorder and Hazardous Gaming Scale. And the second one has been developed by a group in Japan. It calls Games Test. So please remember, you should be very clear on what diagnostic system you plan to use, and choose a screening tool based on that diagnostic system, because if you use a tool based on DSM, you might be screening way more often if you were to use a diagnostic or a screening tool based on ICD-11. So that is something that we need to keep in mind when we are screening for behavioral addictions in our clinical. In conclusion, I would say that ICD-11 has made a major transition I would again repeat that phrase. There is a kind of a paradigm shift in terms of inclusion of behavioral addictions. So, since this is a new concept, we need to familiarize ourselves with these criteria. But please remember, there are certain clinical implications, and these include the kind of behavioral addictions we can diagnose using ICD-11, the kind of criteria that is there, the extent of similarity or dissimilarity with other kind of addictions, particularly addictions to substances, psychoactive substances. And finally, please be very cautious with the choice of the screening tool that you plan to use to screen for behavioral addictions.